Do we have to watch more closely the medications that patients are taking during breast cancer treatment and follow-up? Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care. There's a new paper that was released where they were looking at various medications that patients were on, looking at clinical trial databases. So these were over 23,000 women, and they were looking at some clinical trials, some famous ones. Like one of them that I saw was like the Cleopatra trial. So it's a well-known trial. And they were looking at to see, is there any signal to show that it impacts your survival, like living longer, living less, side effects, adverse events. And what they saw was that they linked, in particular, the PPIs. So those are proton pump inhibitors. Those are very effective medications at reducing stomach acid in the stomach, were actually linked with worse survival. And then when they were looking at like other medications, so in particular there were classes of high blood pressure medications, so beta blockers, the ones that end in ol, the ACE inhibitors that end in pril, like ramipril, and the ARBs that are linked end in sartans, and calcium channel blockers, so like amlodipine. While they weren't linked with worse outcomes, they were linked with more adverse events, more side effect issues, potentially impacting cardiovascular, renal, etc. So this is again, and these trials, they're not like a cause, but they're a link. It's a signal. And in particular with the PPIs, there's a growing signal of potential concern that is growing. So there's a new paper, for example, in glioblastoma showing another signal of concern with PPIs. And while I find there always tends to be this focus by pharmacy teams looking at natural health products and vitamins and other things of interactions, I have yet to see a patient where there's been any adjustment whatsoever with the medications that they're on. So for example, say PPIs, like they're effective, they're useful, but how about maybe they need gentler ones like the H2 blockers, like famotidine? How about Tums? How about baking soda? So you never hear that and you never see that, but yet they're quick to kind of look at any vitamin, natural health product somebody might be on. So again, while this is a link, it's a growing amount of research that continues, and this analysis was quite extensive, and so obviously more information to come. And what they also noted was that the metformin, the diabetic medication, and the statins, they actually were neutral. They didn't, like, say, impact negatively survival, but they also didn't enhance survival. And that's important because there's been a lot of discussions of, can metformin, for example, help to fight cancer, breast cancer? For the most part, the trials have been quite disappointing in that area, and the statins, appear to be similar. So anyways, I just want people to know this is what's been published, and patients need to be aware of, including pharmacists and oncologists, just so that they're better aware of what's published out there.